Welcome to the Epicore platform training course. This course will explain key concepts of the Epicore project and provide you step-by-step instructions on how to use the Epicore platform. By the end of this training, you should feel comfortable using the Epicore platform and applying your knowledge and expertise to this innovative global surveillance network. Learning objectives for this course include understanding what Epicore is, how does ProMed relate to Epicore, why you should become an Epicore member and what you'll gain from it, what a request for information is and how to respond to one, and how to use the Epicore platform. So what is Epicore? Epicore is an outbreak surveillance project that draws on the skills and knowledge of trained human, animal, and environmental health professionals around the world to verify outbreaks of emerging infectious diseases. It aims to do so using innovative surveillance methods to help find outbreaks faster than traditional methods, building on the concept that faster outbreak discovery and implementation of control measures will help save lives. Epicore was created as a partnership project between the Skoll Global Threats Fund, HealthMap, ProMed Mail, and TefiNet. It creates a virtual community through its moderated digital platform. The Epicore platform provides online training, allows resource sharing, and facilitates communication between trained health professionals in order to improve outbreak detection around the world. Communication on Epicore is facilitated by what are called requests for information, or RFIs for short. RFIs ask for information on disease outbreaks. We'll talk more later in this module about what RFIs are, who sends them, and why they're important. Please take a moment to pause the presentation here and answer this question. There are certain minimum credentials Epicore members need to have. They need to have a degree in the human or animal health fields, which could be human or veterinary medicine, nursing, microbiology, or a similarly relevant field. Plus, they need to have knowledge of the basic principles of epidemiology, infectious disease, and or related fields. All Epicore members must also have at least 2 of the following qualifications: an advanced degree in public health or a related field, such as an MPH or MCH, a health professional certification or licensure, like an MD, a DVM, or an RN, 3 to 5 years of experience in human or animal health, current affiliation with a medical center, university, ministry, Department of Health, or other health-related organization, including NGOs and private sector organizations, or successful completion of a field epidemiology training program. Okay, you're interested in Epicore, but you might be wondering, why should you become an Epicore member? Let's start by mentioning that only qualified and experienced health professionals are selected. So this means that as a member, you'll be part of an exclusive and elite cohort. The benefits from participating are numerous and vary in magnitude by country and region. For example, for some countries that do not have good disease surveillance systems in place, Epicore helps health professionals in one area or sector be aware of any outbreaks in other areas or sectors of the country. Additionally, some countries do not regularly or consistently share surveillance information with neighboring countries due to linguistic, cultural, or even political barriers, which, as we all know, do not stop pathogens from crossing borders. Epicore helps health officials and professionals in these countries learn about potential outbreaks nearby. This information can help them initiate life-saving preparation and control measures. In our globalized world, it can even be beneficial to know about outbreaks thousands of miles away, allowing health officials around the world to appropriately prepare to receive travelers from affected countries and to monitor new cases. It will also help you, as an Epicore member, to make sure that correct information about potential outbreaks in your country is shared with the rest of the world. If, for example, you receive a request that you know is based on a false rumor or simply inaccurate or irrelevant information, you can help make sure that the correct information is being shared. The bottom line is that increased reporting provides greater awareness of what's going on around us, which helps us all to be more prepared. In our modern world, infectious diseases can travel fast. Our Epicore members can help protect people in their communities, countries, regions, and across the globe. Your participation will be critical in helping to prevent epidemics and save lives. By becoming an Epicore member, you'll help change the landscape of disease surveillance. In return, what's needed from you as an Epicore member is simply your knowledge and a very small amount of your time. We hope you find this project as meaningful and worthwhile as we do. Let's work together to help health officials prevent the unnecessary spread of outbreaks that impact the lives of countless people around the world by finding these outbreaks faster. Previously, we mentioned the requests for information, or RFIs, that will be sent via the Epicore platform to Epicore members. Now we'll talk about where RFIs come from and the purpose they serve as part of Epicore. RFIs are sent by a group of experts from ProMed Mail, which we introduced in the first module. These experts are carefully selected infectious disease specialists based around the world who are trained to recognize possible outbreaks of public health significance. They continuously monitor non-traditional information sources and publish reports on emerging and re-emerging diseases from all over the world. ProMed Mail, or simply ProMed, is an internet-based reporting system that's dedicated to the rapid, global dissemination of information on outbreaks of infectious diseases and acute exposures to toxins that affect human health, including those in plants and animals grown for consumption. ProMed's reports are published online along with expert commentary, which are accessible on their website and are sent by email to its 75,000 subscribers. ProMed operates 7 days a week, is free of charge, open to the public, and is non-political. Here you'll see some of the posts on ProMed. Pause here to explore the ProMed website, and while on the site, try to find a post about your country or a neighboring country. Also, here's a link you can use to know more about moderators. Did you find a report about your country or a neighboring country? Now imagine a similar post on a possible outbreak in your country or region, only it's missing vital information or simply has incorrect information. This is when you get a chance to verify outbreak information in your country. To summarize, RFIs are the method of communication used by Epicore and are sent to Epicore members by the ProMed moderators. You can respond to any RFI you receive to correct or fill in missing vital information, or to verify outbreak information received from an informal source. The information or verification you're able to provide means that more accurate news of this potential outbreak will reach those who need it more quickly and could help the affected area avoid a pandemic. Pause the presentation here to answer these questions. You may be wondering by now what type of information you should provide in an RFI response. Here are some examples of the types of information that should be gathered. Information on person, such as demographics like age or gender, case numbers, fatalities, lab results, diagnoses, pathogens, supporting information, or information on place, such as the location of patients, and information on time, such as the date of occurrences. Remember though, some information is better than no information. You might already know the information you want to use in your response, but you may also decide to gather or reinforce your information by phoning a friend or colleague, checking local media like newspapers, radio, or television, checking social media in your language for any trends on the disease or symptoms, checking official reports, going back to the original source, or calling a local hospital, clinic, or health center. There's only one more step remaining to become an Epicore member. Now we'll show you how to use the online website. First, you'll begin receiving RFIs directly to your email inbox. Here's an example of an email regarding an RFI. Click on Respond to this message, and then click on Continue to Epicore. If you receive an RFI and you're logging in directly from the email, you'll be directed to the response page for that RFI where you'll see the text box ready for you to type in your response. However, there's also an option of logging in directly to the Epicore.org platform using your credentials. If you log in directly to the website, your home page will look like this, and you'll see all of the open RFIs you've received listed here. Let's go ahead and respond to one of those RFIs. When you're in the review page, click on the RFI you'd like to reply to. Once you click on an RFI, you'll be asked if you have any information to contribute regarding the suspected outbreak. If you do have information on an outbreak, click on Yes, respond to this request. You'll see a text box in which you can type your response. This is the same page you would have been directed to if you clicked on the email link to respond. When you respond, your identity is always hidden, so moderators will not be able to know who you are unless you choose to reveal that information in the text of your response. After filling out your response, you will then need to select your preferred confidentiality setting. We've created options here to help you communicate to the moderator the level of confidentiality you prefer. You can choose to ask the moderator to directly quote your response and attribute it to you when including it in his or her post. If you choose this option, you'll need to remember to include your name and affiliation, since it won't be revealed to the moderator any other way. If you want to give the moderator permission to quote your response but do not wish to provide any details on your identity, you can choose this option, or you can request that the moderator paraphrase your response entirely. It's important to note that even if you wish to remain anonymous, ideally, you'll still share your name, title, and location so the moderator knows that the information provided is credible before disseminating it, just as any good journalist would do. Or you can ask the moderator to keep your identity confidential, which they're trained to do, and they currently routinely do when information is submitted to ProMedMail. It's preferred that you, at a minimum, let the moderators know your location, but it's certainly up to you to decide the level of information you're comfortable disclosing in each response. After all fields have been completed and your preferred settings are selected, click on Submit. While the Epicore website is built to protect your anonymity if you need it, you also need to safeguard your own privacy by making sure that you're not being monitored while submitting a response, and to close all other pages on your browser, as some social media pages, if opened simultaneously with Epicore, can jeopardize anonymity. After clicking Submit, you'll be directed to another page where a verification box appears, stating that your response has been sent to the moderator who initiated the RFI. Always remember when responding to an RFI that some information is better than no information. However, if you don't have any information at that time, simply click on No, not at this time. Once you've clicked this button, a message will be sent to the moderator notifying them that you do not have any information to contribute at this time. If you come upon new information to contribute to an RFI after you've clicked No, not at this time, you can always go back and contribute to the RFI in the future. It's important to note that you'll only receive an RFI if an outbreak is suspected in your country or region. This means that you might not receive an RFI for weeks, or you may receive several in the span of a few days. When a moderator sends an RFI to members within a certain geographic area, he or she will assess all the responses received, and if sufficient information was provided, the moderator might decide to close the RFI. This will move that RFI from the Open Events tab on your dashboard to the Closed Events tab. But note that you'll still have the ability to respond to RFIs even after they're closed. And this is because we recognize that you might come upon information on an outbreak that you think is important to communicate after the moderator closes it. After moderators receive your response, he or she will assess it, along with any other responses received, and they will then use the compiled information in a post to be published online on ProMed Mail's webpage that will also be sent to its subscribers. See, it's really that simple. Your verification of an RFI will help you and the rest of the Epicore network find and confirm outbreaks faster by verifying potential outbreak signals. By detecting outbreaks faster, health officials can generate an early response that can curb epidemics and save lives. Think about if we'd known about the Ebola or MERS outbreaks a few weeks earlier and how much difference this would have made. This is how you and Epicore will be changing the landscape of outbreak detection and reporting. We can't wait to start working with you. We're happy to answer any questions you may have. Please send any questions to info@epicore.org.